Hi everyone, and welcome to my latest Phlebotomist study log. This video is all about the chapter on point of care testing or POCT, and I've got 30 questions lined up for us. For each one, hit that pause button and see if you can figure it out. Before I go over the answer, hope this helps. Let's do this. The percentage of packed RBCs in the volume of blood is known as the packed cell volume. A handheld HGB analyzer gives a readout whose units are in grams per deciliter. What POC point of care test can be used to monitor heparin therapy? ACT activated clotting coagulation time, APTT activated partial thromboplastin time. What test can provide valuable information regarding whether a patient has experienced a myocardial infarction? Cardiac TNT, troponin T, and TNL, troponin L. What test can be used to screen for colon cancer? Occult blood determination of HCG, human chorionic gonadotropin, is used to evaluate pregnancy. What type of specimen is used for the occult blood test? Feces. What streptococcus group is detected when performing a rapid strep test on a throat culture? Group A. Before performing the dipstick test for a routine urinalysis, what two pre-testing conditions must be met? Specimen must be at room temperature and well mixed. For a POCT program or point of care testing program to be successful, which of the following must be incorporated? A. Adherence to the manufacturer's instructions. B. Use of quality assurance and a quality control procedures. C. Proper and adequate training for all personnel. Define POCT and state four locales in which it may occur. Point of care testing. POCT is the performance of analytic test immediately after obtaining a sample at the point of care, such as the bedside, clinic, intensive care unit or emergency department, physician's office, nursing home, assisted living center, or patient's home. State an advantage and a disadvantage of POCT. Advantages to POCT include shorter turnaround times for obtaining test results, allowing more prompt medical attention, faster diagnosis and treatment, potentially decreased recovery time, and decreased cost to the laboratory. Disadvantages include misleading test results because of improperly following manufacturer's directions, inadequate training of personnel, improper maintenance, and poor record keeping. Describe the use of and the need for adherence to quality assurance and quality control procedures when performing POCT. Quality management and quality controls are vital to ensure the accuracy of POCT instruments. The laboratory typically holds the responsibility for the documentation and maintenance of POCT devices. Furthermore, adequate training for all staff conducting this procedure is the main key to successful POCT implementation. Strict adherence to protocols, including calibration, running controls, maintenance, and record keeping, is a mandate in a POCT program. Negligence in just one aspect has the potential to produce misleading test results. which can negatively impact the patient. Stage 2 hematology test that can be performed as POCT and indicate how each test is done. Hematology testing available through POCT includes the evaluation of anemia and polycythemia alongside monitoring of blood coagulation. Stage 4 chemistry tests that can be performed as POCT and indicate how each test is done. Chemistry tests that can be performed as POCT include glucose, cardiac troponin, T, cholesterol, blood gases, and electrolytes. Name the five waves that make up an ECG. The five waves that make up an ECG are P, Q, R, S, and T. Name the heart activity that corresponds to the following P wave, QRS complex, ST segment. A. P wave. The heart activity corresponding to the P wave is atrial depolarization. B. QRS complex. The heart activity corresponding to the QRS complex in ventricular depolarization. C. ST segment. The heart activity corresponding to the ST segment is ventricular repolarization.
Describe how to perform a dipstick urinalysis test. The dipstick urinalysis process requires preparing the fresh urine specimen by bringing it to room temperature and mixing it thoroughly. The strip must then be quickly immersed completely in the specimen. After removing the strip, blot away extra urine by tapping the strip side on the container. The final step involves comparing the color reaction on the strip with the reference chart on the bottle at the correct read time. Explain why it is important to follow the manufacturer's instructions when performing POCT. Due to the variability in testing methodologies among different manufacturers, strict adherence to the provided instructions is absolutely paramount when performing POCT. Failing to follow the specific procedures outlined by the producer can lead directly to the generation of inaccurate test results. Describe the POC test that can be used to evaluate the following. A. Anemia. Anemia may be evaluated using a handheld hemoglobin analyzer or a hematocrit reading. B. Warfarin therapy. Warfarin therapy may be monitored by using the prothrombin time test. C. Cholesterol. Cholesterol may be evaluated by using color card testing or instrumentation. D. ABGs. Arterial blood gases may be evaluated by using handheld analyzers. List the common electrolytes that can be measured by POCT. The electrolytes frequently measured using point-of-care testing, POCT, are sodium, potassium, calcium, chloride, and bicarbonate. Describe the normal ECG pattern. The normal ECG pattern consists of a tracing with 5 prominent points where the graph changes direction. These are known as P, Q, R, S, and T. The sections joining these points are known as segments, complexes, or intervals. Each part of the graph corresponds to a particular portion of the cardiac cycle and can be analyzed to determine how the heart is functioning. Relate ECG tracing to cardiac activity. The ECG provides essential data, including the time intervals between cardiac cycle phases, which reflect the efficiency of electrical conduction. Furthermore, the amplitude of the electrical signals is a significant indicator, as it correlates with any increase or decrease in heart muscle mass. Since each small box on the tracing represents a known time unit, the total duration of the cardiac cycle can be directly measured from the ECG. List the dipstick tests that are routinely performed on random urine specimens. The standard dipstick urinalysis on random samples assesses several key components, including protein, pH, glucose, ketones, bilirubin, urobilinogen, blood, leukocyte esterase, nitrite, and specific gravity. What types of specimens are used to determine pregnancy? A dipstick urine test is commonly used to determine pregnancy, measuring the presence of HCG. This hormone, produced by the placenta after implantation of a fertilized egg, is present in urine. List the adherence guidelines for a POCT program. List the detrimental outcomes of failing to adhere to these guidelines. The adherence guidelines for a POCT program to be successful are calibration, running controls, performing maintenance, and record keeping. Not adhering to the guidelines can result in inaccurate test results and negative consequences for the patient. The microcuvette tests and measures. Blank. And is essential in. Blank. The microcuvette tests and measures the hemoglobin value and is essential in determining the response to therapy. List the process used in ACT and the timed intervals if a clot does not form. ACT is the activated coagulation time. Blood collected in a pre-warm tube is incubated at 37 degrees Celsius for 1 minute and then inspected by tilting the tube to determine whether a clot is formed. If a clot does not form at 1 minute, the tube is examined every 5 seconds until a clot forms. List the 3 analytes obtained in an ABG sample and the common electrolytes. The analytes obtained in the ABG are PO2, PCO2, and pH, and the common electrolytes tested are sodium, potassium, calcium, chloride, and bicarbonate. List the proper electrode placement for the leads of an ECG. The electrode placements for the precordial leads of an ECG are as follows. V1, fourth intercostal space in the right margin of the sternum. V2, fourth intercostal space in the left margin of the sternum. V3, between position 2 and position 4. V4, fifth intercostal space at the left midclavicular line. V5, fifth intercostal space at the anterior axillary line. V6, fifth intercostal space at the midaxillary line.
Thank you for watching my video. See you next time. Bye.